Dear colleagues, welcome to our day 4 here in beautiful Barcelona for ESMO 24. We proudly bring you this OncoAlert roundup of day 3. Please note that these are just some of our picks, and if you would like to dive deeper into the trials, you sign up for the newsletter at the link that can be found in this post, or you can go to www.oncoalert360.com and sign up. That's www.oncoalert360.com. So starting off with 4 concomitant publications we saw yesterday, and the following 3 can be found in the New England. We start off with the Niagara trial, perioperative durvalumab with neoadjuvant chemotherapy in operable bladder cancer by our OncoAlert faculty, Tom Powles and team. The study found a higher 24-month event-free survival in the durvalumab group, 67.8% versus 59.8%, and improved overall survival, 82.2% versus 75.2%. Adverse events were similar between both groups, with no major increase in severe complications or treatment-related deaths. The addition of durvalumab offers promising enhancements in survival for eligible bladder cancer patients. The Ambassador trial, adjuvant pembrolizumab versus observation in muscle-invasive urothelial carcinoma by our OncoAlert faculty Andrea Polo and team. Adjuvant pembrolizumab significantly improved disease-free survival compared to observation, with a median disease-free survival of 29.6 months versus 14.2 months. While pembrolizumab led to longer disease-free survival, it was associated with a higher incidence of grade 3 or higher adverse events, 50.7% versus 31.6%. The findings support pembrolizumab as an effective adjuvant therapy in this patient population. Keynote 522 overall survival with pembrolizumab in early-stage triple-negative breast cancer. In this phase 3 trial, patients with early-stage triple-negative breast cancer who received neoadjuvant pembrolizumab combined with chemotherapy, followed by adjuvant pembrolizumab, showed a significant improvement in overall survival compared to those who received chemotherapy alone. With a median follow-up of 75.1 months, the estimated 60-month overall survival was 86.6% in the pembrolizumab group versus 81.7% in the placebo group. Destiny Breast 06, trastuzumab deruxtecan significantly improved progression-free survival in patients with HER2-low or HER2 ultra-low metastatic breast cancer, regardless of initial local HER2-negative status, underscoring the need for reassessment of HER2 status for treatment eligibility. And out in the Lancet PSMA-4, this phase 3 trial of lutetium PSMA-617 significantly extended radiographic progression-free survival compared to a change in androgen receptor pathway inhibitors in taxane-naive metastatic castration-resistant prostate cancer patients with a favorable safety profile. Also presented in the presidential, the HYPO-G01 trial, which showed that hypofractionated radiation therapy is non-inferior to normal fractionated radiation for local regional early breast cancer with similar safety and survival outcomes, supporting its use as a new standard of care. The NICHE 2 trial sees a combination of ipilimumab and nivolumab result in a 100% 3-year disease-free survival in MMR-deficient colon cancer patients, with all patients remaining disease-free and ctDNA clearing in those with pathological complete response. And ending with prostate cancer and CONTACT-02 by our OncoAlert faculty Neeraj Agarwal and team. Cabozantinib plus atezolizumab showed superior progression-free survival compared to non-hormonal therapy in metastatic castration-resistant prostate cancer, but did not achieve statistical significance for overall survival, though it offered benefits in certain subgroups. And there you have it, folks, your Day 3 roundup. We thank you for your support, and we wish you a very enjoyable Day 4 here in Barcelona.